I guess my first message would be there's a lot that we now know with confidence. We have evidence, we have research based on child and youth care research, not just from other professions or other fields. So SIRCC is a good source for that kind of information. So I'd very much encourage people to get the consultation from groups like SIRCC. I think the challenge is taking that knowledge that we now have and putting it into practice. So the research that I've been doing on the implementation of change, I think, is very pertinent. And the project I'm involved with, the CARE program model implementation, is the first one I've seen that tries to develop a rigorous research evaluation throughout an intensive implementation process. So what we're trying to do is to take the knowledge and wisdom of many years of practice and helping agencies to formulate a framework that they can have confidence in, principles that can guide their decision making, that they can believe in and can work on in order to achieve the kinds of experiences that children need and deserve. So that's what this research is all about, is translating knowledge into practice. And that's where I think we need more studies, share more information about how agencies do that. The CARE program model will not be implemented unless the leadership is 100% on board. They also have to go through the same training that they expect of their workers, because the principles and the knowledge base has to permeate the organization. And if it doesn't come from the leadership, then it probably won't be sustained. The child's best interest is the touchstone, and I think that's been accepted in the UN Convention. Virtually every jurisdiction that has passed child welfare legislation has the child's best interest in it. But the challenge is everybody thinks they're working in the best interest of the child, and yet, as we all know, many are not. And it's not through a lack of goodwill, it's really through a lack of understanding. So I think a program like the CARE program model is trying to develop a baseline framework that any agency can use and have confidence in, which will lead to better practice, which will lead to better outcomes for children. Now, we're not at the stage yet of having all the evidence in. This is a 12 to 15 year research project, and we're in year 3. But the signs so far are very promising, and certainly the workers are feeling much better about the work they're doing, and the agencies are proud to be CARE agencies. So those are good signs. And I think we've gone far too far in the area of trying to avoid risk. And in fact, what's happened is we're not simply avoiding risk for children, we're avoiding our own risk. And agencies are very nervous about the liabilities that they might encounter. And so I think what we have to do is get back to, instead of avoiding risk, we've got to create good developmental experiences for children. And that sometimes involves reasonable risk. I mean, I would not want to advocate unreasonable risk, absolutely not. But even good parents expose their children to a small amount of risk because they realize that's how children grow and learn. They need to be stretched. But within bounds of safety, I think we have to give our children room and space to grow. And so yes, I think the CARE approach is totally focused on positive development, developing competence, dealing with the trauma that children have experienced, and all the kinds of things that good practitioners have always known. But what we've lacked is a framework that an agency can adopt and say, this is what we believe, this is what will guide our practice, and we want all of our staff to be on the same page. We don't want to have people just doing whatever they learn to do through their own upbringing. We want people to be informed by good child care knowledge and good child care practice. I think if you have confidence that by striving to implement these principles, you're doing good things for children, then it's much easier to relax about the process and say, these are the right principles. We're convinced about that, and there's good research to back this up. And yes, we may make some mistakes along the way, but we're going to make mistakes in service of the children's best interests, not to protect ourselves or to limit liability. We're going to have a reasonable appetite for risk. And I know that in Scotland there is a reaction now to how far the risk aversion has gone, to the point where people hide behind checklists, And I really think that that's a negative thing. I think what CARE does is put its faith back in the right place, which is in the workers. If we're going to make a difference with children, it's the people who live and work with them day to day who are going to make that difference. And we have to have faith that they can learn and they can develop and they can provide excellent care. And I know from my own experience that that can be done. And it's not just a matter of education, it's a matter of I think accepting that there is a better way of doing things and committing to learning that way. Well, my hope would be that we learn about how change can come about. Whether or not the CARE model is the way. I do think it's generic enough, though you asked the question about is it generalizable, universal. I think the needs of children are universal, and I think the principles of good care are universal, but how they will be translated into practice may be quite cultural. So what we're learning is how it works in a certain culture, southern United States right now, but also agencies around the world are beginning to implement this model. We're just not doing the rigorous research. We can't do it on every agency. But hopefully there will be a conference next year, for example. I hope SIRCC will be there, and where people will be sharing their experiences and will be reflecting on the research that is being done and either validating it or modifying it or adding to it in some way. So my hope is that the learning will continue, that it will be shared as widely as possible. Every jurisdiction, every agency that wants to do this should have access to the knowledge. But how we sustain it, I think, is something the field as a whole is going to have to work out. And those are the discussions that are going on now. You know, the model has been developed, the initial training, the initial development has been done, evaluation is ongoing, and now the question is, what can the agencies tell us about how do we keep this going? How do we keep the learning happening? And how do we share the results of our learning? And it's not just up to Cornell University or myself, it's really going to involve all the agencies who are participating in this project.